Dr. Sharyl Truty, owner of Balanced Physician Care, a primary care and integrative holistic medicine clinic here at the Beaches. And one of the things that we do unique in our practice is we have a membership-based practice option for patients who are really looking for a good relationship with their physician and for convenience to come back to healthcare. As part of our membership, we offer a lab work panel that's part of our premier membership. And today I'm just going to go over a little bit about what screening blood work typically is, what usually a wellness panel typically is for most practices, and specifically what our own is, and why we do them and what we're looking for. So first of all, most of the time as primary care physicians, when we're doing your annual wellness blood work, part of that is lab work is going to be fasting. So just a couple of quick tips. Most people know what fasting means, but for most of us as physicians, that means we don't want you to eat or drink anything for 8 hours. Don't eat anything for 8 hours prior to the lab test. So again, you can drink, water is fine, or any liquids like tea or coffee, but they can't have any sugar in them and they can't have any cream in them. So that would affect some of the blood tests that we're going to do. So when you're going in for blood work with us or for your physician, and it's fasting blood work, again, usually most of us like an 8-hour fast and to, again, avoid eating. Another thing people often are confused about is whether you should take your medications or not. We usually do want you to take your medications. So go ahead, take them with a few sips of water. And yes, they'll be taken on an empty stomach, which for certain ones may not be ideal, but still you'll probably get most of everything absorbed as it should. And we want to keep the timing of what your usual timing is of your medications and not change that to a significant degree. The other thing that I always try to remind people is to make sure you drink a lot of water before the lab test. It just makes it so much easier for those that are drawing your blood, especially if you have veins that may be a little bit harder to find. If you make sure you don't have too much caffeine, skip your coffee until afterwards, or have some decaf coffee or tea that morning. That way, it'll be a lot easier for the people who are drawing your blood work to get them. So that's a little bit about the tips and tricks, for getting your wellness blood work. Now, what typically does that include? Well, in our practice, and I think most wellness panels, typically the blood work includes a CBC or complete blood count, a CMP, which is a complete metabolic panel, a lipid panel, and a thyroid panel. And those are for most of us, the main things that we consider, part of that wellness screening. Certainly there are other things that we will add on individually based on what certain patients need, especially some of the important nutritional vitamins that we want to keep an eye on. But the basic wellness panel are usually those things. So what is exactly a CBC? So a CBC is a complete blood count. And what are we screening for? Well, one of the things that we look at is your white blood cells, and we look at whether they're in the range that they're supposed to be. If the white blood cell counts are high, that could be a sign that there's an infection brewing somewhere in your body that we're not aware of, and it's probably a significant one if it's going to raise your blood counts. Also, we're checking for any kind of bone marrow problem like a leukemia or an immune disorder. If those are off, it's going to change your white count. And the other thing is drug reactions. Sometimes if you're having a drug reaction, that will change your white count. In that white blood cell count, we often check there's different types of white blood cells. And significantly, if you have elevated eosinophils, that's a sign of allergies. If you have elevated basophils, that can be a sign of inflammation. Mostly we're looking at the counts, but we also take a look at the different types and see if there's any patterns that arise there. The other thing on the complete blood count is your red blood cells. Our red blood cells are important for carrying oxygen throughout our body. And so the important part of that red blood cell is the hemoglobin molecule. And so we take a look at the red blood cell and the hemoglobin and molecule, and we're trying to judge how well your body's capacity is to carry oxygen through how well the iron stores are. And so we have a good idea, Now, sometimes if we're suspicious, we'll add some other iron studies or a ferritin on to look at things more in depth. But usually a hematocrit and a hemoglobin are good at telling us whether you might have anemia and low iron. On the opposite, you can have high iron. There are certain populations that have elevated iron, which can lead to a condition called hemochromatosis. And that is accumulation of iron in the liver, which could eventually lead the liver to develop difficulties. So again, we're kind of looking at that and screening for that. And the last part of the complete blood count are the platelets. So we're taking a look at the platelets to see if there's anything there. I mean, most of us don't have issues, but every once in a while you can. And high platelets could be a sign of anemia. Besides the hemoglobin, it could be a sign of inflammation. It also could be a sign of cancer. Typically after surgery, your platelets might change as well, but we usually have a context through which we put that in. Low platelets, we worry about infectious processes. There's several viral infections which can lead to low platelet counts and nutrient deficiencies if those are the case. So we do get a lot of information just out of a CBC. The next thing, like I said, is the CMP, or a complete metabolic panel. And in the complete metabolic panel, the first part that we look at is your sugar. Often there's a glucose that's done with it, and one of the reasons to make you fasting is a fasting glucose is a very good screen for diabetes. And if your sugar is high, then we're going to go and do some follow-up testing. So typically a high fasting sugar is considered anything over 100. And that's going to prompt us to do some testing to see if there could be some pre-diabetes. Now, just because it's over 100 doesn't mean that there necessarily is. I've seen plenty of patients who have had a random sugar over 100. We've done the follow-up hemoglobin A1C testing, and it's been less than 5.7. But it usually is a sign that, hey, more testing needs to be done. Some people will also recommend hemoglobin A1C testing when your sugar falls somewhere between 70 and 100 as well. Some people are just more aggressive at taking a look, especially if you have a family history. The other part of the complete metabolic panel is the kidney function. It's always a good idea to keep an eye on that. Even patients who have perfectly healthy and feeling perfectly fine can begin to show some signs of kidney distress. And it can be silent, and there's no way that you really know without doing a screening test. So typically that we look at what's called a BUN creatinine level as well as a GFR level. And those kind of give us an idea of how well the kidneys are functioning and if everything is going well with that. The other part is the electrolytes. So typically, most of the time, electrolyte changes are happening when you're in a very sick process. So a lot of times when you go to the emergency room in your hospital, this is when we're really watching these, because this is when we're seeing a lot of these things change. For most of us, if we have healthy kidneys, if we have healthy digestion, these electrolytes are going to be good. But certainly there are always situations that can change these. Marathon runners, can cause changes in their electrolytes. Certainly when I was covering the Chicago Marathon for 10 years, we would see, patients who, had lost so much sodium to sweat and lost water that they created changes in their electrolytes that then had to be, managed acutely on site or transferred to the hospital. Other situations can be medications. A lot of people, potassium is a very important electrolyte that's important for the rhythm of the heart. And so we really want to make sure that that electrolyte is staying in the range that it's supposed to. And again, if you have good kidney function, everything else is good, you're going to expect that to be normal. But again, this is why we're doing these screening tests, is tests to check for this. If your sodium's off and if your potassium is off, besides your kidneys, we're looking at heart failure issues, or sometimes people doing on certain medications or certain supplements, can cause disruption in electrolytes. Another thing is brain dysfunction. So if you've had traumatic brain injury or something else going on, our brain does control everything, and that can also, cause some changes, especially in sodium. And certainly if you are having the stomach flu and you're throwing up and you're vomiting, this is, something that can change rather quickly. Obviously, if we're doing a screening, we don't expect that to be going on, but it is part of what we check on a regular basis. The other part of the CMP is checking the liver enzymes. The liver is very resilient. A lot of us are always concerned about it. We've had several talks that we've done on helping the liver work better, on detoxification. Certainly there's a lot of medications, there's things in our environment, there's different foods that we eat that our liver is working on metabolizing. And so one of the things that we're always screening for is to see if the liver enzymes are doing well. And part of the liver enzymes are certain things that also look at the gallbladder. We're looking for signs of viral infections like hepatitis. We're looking for signs of elevation in the liver enzymes to call that maybe you might have a kidney stone, and looking for fatty liver, which could elevate your AST and ALT. Yeah, typically liver enzymes are the AST, the ALT, and the ALK phos are the three biggest ones that are part of the panel that we're looking at to evaluate and see what their ratios are. I've had patients that have been very sensitive to Tylenol or have had viral infections, and we've screened them and caught them on wellness exams when we found these to be high. The other lab test that most everybody knows about is the cholesterol panel. As most of us know, cholesterol is a risk factor for heart disease. And we always want to take a look at this because it is definitely something that is very responsive to diet and to preventative changes. And so I try to remind people, though, that cholesterol is not about today or next week or next month. The numbers are about preventing heart disease 10, 20 years down the road. And so we do have an opportunity when we're looking at your cholesterol, if it's elevated, to make some changes and to impact your body's cholesterol levels. So there's the total cholesterol number, which I think most people focus on when they see their labs. But for us, we're not just looking at total cholesterol. We're looking at the LDL cholesterol and the HDL cholesterol. So the LDL is often called the bad cholesterol, and the HDL is called the good cholesterol. And the third part of that is the triglycerides. The triglycerides are very sensitive to food that you've eaten prior to the blood draw. So that's one of the reasons why we want you to be fasting, as well as the good cholesterol, can be very sensitive. The bad cholesterol can be very sensitive to the food you've recently eaten. So that's why we ideally want you to be fasting. So, if your LDL is high, typically some of these numbers are, vary from person to person, and they vary, based on what else is going on, what are our ideal numbers. So I hesitate to give you a number, without knowing, in general what your history is. But the LDL, for those that are perfectionists, we'd love to see below 100. But for most of us, we're trying to look to get you somewhere around 130. Certainly as you get older, and your risk factors change, maybe we might want to see that even better. Your good cholesterol, the higher that is, the better. So if you just look at your total, you're not getting the whole picture, because you really want your good cholesterol or HDL to be as high as it can be, and your LDL to be as low as it can be. And that, we'd love it if it's above, 55, if it's somewhere in the 60 range, because then it's protective. The things that help, though, to increase that are, some of that's genetics, but exercise, is very, very good at raising your HDL, especially cardiovascular exercise, and LDL is helping to lower your LDL. And obviously diet plays a large role in this as well. And so there's many things that we can talk about from a dietary standpoint that can make an impact. Obviously there's herbals that can help improve cholesterol function, as well as medications. And if you are on medications, we're obviously going to monitor these numbers closely, because we really want to find, in my mind, the minimum amount of medicine that it takes to achieve the goal. And again, I like to stress that really your cholesterol is part of a larger picture. And so I often put your cholesterol numbers in what's called a calculator. The American Heart Association has a calculator where they calculate your age, whether you have high blood pressure, whether you smoke, whether you have diabetes. And we put all this together to estimate what your risk is, to decide if you're someone who needs medication or if we just need to focus on diet and exercise. Another part of our screening panel that we like to do is the thyroid screen. There's a lot of people who have family history of thyroid disorders, and they begin to just sort of feel off and not quite right, or they have problems with weight. And so again, thyroid can often be silent until all of a sudden it rears its ugly head. Signs of low thyroid are constipation, being cold, difficulty losing weight. Signs of high thyroid are anxiety, heart beating fast, diarrhea, and being warm a lot. Obviously, a lot of those symptoms go with a lot of other things and a lot of other hormones, but the thyroid is, an easy hormone to be able to screen and take a look at. We typically here do a screening TSH, and then I like to follow that up with at least a free T4, just to help me get the whole picture of what's going on. And depending upon the patient's history, I might add a free T3. The last thing that we do is just a urine analysis. And it's just a quick screen. It's just to see if there's anything there that we need to pay attention to, to look for blood, to look for any signs of infection there that might otherwise be silent. With the urine, especially as we get older, we want to look and screen for bladder cancer. And we want to make sure that if there's any infections going on, we catch those early. So those are what our wellness panel typically is. And those are what, most commonly most people do. In future Facebook Lives, we'll talk about, other labs that we do. I find additional labs beyond wellness screening labs to be some of the vitamin labs like B12 and vitamin D and magnesium. And sometimes we look at some of the advanced heart testing labs like the lipid panel that looks at particle size, the NMR panel, cardiac CRP and homocysteine levels, are also advanced screening. And so some of that just depends on what our patient's family history is and what symptoms they're currently having and what's important for them in prevention. So again, my name is Dr. Sharyl Truty. I'm owner of Balanced Physician Care. And I thank you very much for joining us here today on our Facebook Live about blood work, specifically the wellness screening blood work that we do as part of our membership. So again, the name of our practice is Balanced with a D Physician Care, and our website is balancedphysiciancare.com. And if you're interested in our practice at all, please check us out on our website or give us a call at 904-930-4774 or email us at membership@balancedphysiciancare.com. Thank you very much for joining us this afternoon on our health lunch hour. Take care and have a great afternoon.